He's away from needing hospice care, struggling to survive cervical cancer.
I couldn't physically do anything. I couldn't even walk my dog. And I was going to give up.
But Sandra Wilson says a new clinical trial going on at Levine Cancer Institute right here in Charlotte saved her life. And tonight, she is sharing her story only with Channel 9.
Anchor Alison Lottis explains the treatment giving patients new hope for survival.
There was a time when simply walking was nearly impossible for Sandra Wilson.
I couldn't physically do anything.
In June 2016, the Mooresville woman went to her doctor with sudden bleeding and pain, then faced a devastating diagnosis.
I had stage 3B cervical cancer.
Sandra underwent chemotherapy and radiation, but nearly a year later, when she started coughing up blood, doctors at Levine Cancer Institute discovered the cancer spread.
This is one of the large cancers that you can see in the lung.
A huge tumor right here, pressing up against my trachea, and 3 lymph nodes of my lung had cancer.
Sandra was given 8 months to live. Her body no longer responding to medications. She was only days away from needing hospice care. Until doctors started Sandra in a clinical trial, immunotherapy.
We're using the body's immune system to fight the cancer. The immune therapy brings in the inflammatory cells to kill the cancer. And so sometimes you have some scarring, but eventually these lesions will melt away.
Dr. Nauman says patients around the world are part of this immunotherapy clinical trial, and it's working. Many of his patients, like Sandra, are now in remission.
Cervical cancer, when it comes back, the median life expectancy is less than a year. So when you see treatments like this that make the cancer go completely away, that's really exciting.
Sandra is again able to enjoy her passion for fitness and horses. Because of immunotherapy, she'll soon celebrate 2 years cancer-free.
Yeah, I'm a miracle sitting here, and I know I am. I just hope that what I've been through can help other people.
Sandra will receive her last immunotherapy treatment in June, and doctors will follow her for 2 years with CT scans every few months just to make sure the cancer doesn't come back. Not all types of cancer respond well to immunotherapy, but doctors hope this specific treatment for cervical cancer will get FDA approval so that more patients can receive it. Thanks, Allison.